Nasolabial fold filler. Discussion. Whilst filling the nasolabial fold with derma fillers may be necessary, one must also consider other adjunct treatments. These include creating structural support in the cheeks with fillers, or tissue lifting energy-based devices such as HIFU or thread lifts. Warnings regarding filling the nasolabial fold. Injecting derma filler to this area is associated with necrosis due to the vascular occlusion. The area of necrosis may affect the nasolabial fold as well as the nose. Injection technique. There are 3 different injection techniques for this area. These include injecting the bolus with the needle into the supraperiosteal plane, injecting with the cannula into the superficial fat plane, and ferning technique with the needle into the subdermal plane. The aesthetic outcome differs based on the technique used. The choice of technique depends on each individual case. Most patients require a combination of 2 techniques, so one must use the right tool and inject in the right plane to avoid the artery, whilst achieving optimal aesthetic outcomes. Technique 1. Supraperiosteal plane bolus injection. This technique allows subtle lifting of the apex of the nasolabial fold. When using this technique, the needle tip touches the bone and maintains this depth during the injection. The needle should point medially. Keep the needle tip constantly moving. Boluses should not exceed 0.1 milliliters, after which the position of the needle tip needs to change. The risk of necrosis is highest, especially when the needle tip is not aiming medially, not touching the bone, or if too much volume is injected. Technique 2. Injection technique with the cannula. With this method, filler is deposited into the superficial fat plane. This technique is suitable for filling the entire nasolabial fold. However, if lifting the apex alone is required, then this method is not as efficient as depositing a bolus injection with the needle to the supraperiosteal plane. Technique 3. Ferning with the needle. The injection depth of this technique is subdermal. This plane produces the lowest risk of injury. The medial aspect of the nasolabial fold is usually sunken and depressed in comparison to the lateral side. There may be an overlap of lateral tissue over the fold. This is particularly common in the superior end of the nasolabial fold. Only inject the medial deficient side of the fold, especially near the superior end of the nasolabial fold. At the lower end of the nasolabial fold, the fold presents as a linear depression in the skin, and the medial and lateral sides tend to be equally leveled. Therefore, ferning injection on both sides of the crease is needed at the lower end of the nasolabial fold.